Hi everyone, welcome. It's 2025. Happy New Year. We are going to get right into human rights content. So, the last few weeks, I have been shadow banned on TikTok, mostly because Patrick and I came back to the United States and I was talking a lot about how global governments affect reproductive access and human rights for women, and got myself flagged a little bit, but it's okay. 2025 is going to be a full sun into human rights policy and really what affects accessibility. Last year in 2024, we really set the foundation for my nonprofit legally, fundraising wise. We built an incredible community online. This year is going to be much more policy focused. So let's get into it. Let's talk about why every hour one woman in Tanzania passes away from birth-related complications. That is 24 women a day and almost 9,000 women a year passing away from almost 100% preventable death. Tanzania, like many other sub-Saharan African countries, faces an incredible shortage of healthcare accessibility. For every 10,000 people, there are 10 available doctors. Many rural facilities don't have healthcare facilities at all, forcing women and children to travel long distances to even receive any sort of care. And that's assuming that they can make the trek or that they can afford the transport. And even when there are medical facilities, in most cases, they are underfunded and understaffed. One of the biggest barriers to healthcare is poverty. Over 60% of Tanzanians live on less than $2 a day. That, in conjunction with lack of education, is really difficult for people to understand how to get access to healthcare and why it's important at all. Many women simply do not know the importance of prenatal care, and because of those educational gaps and societal norms, cannot access that kind of basic quality care. These areas need immediate aid, but more than that, they need long-term solutions when it comes to education and when it comes to healthcare. And when it comes down to it, it's funding. Without funding, you can't build proper education systems or healthcare facilities or training for future doctors. Like most countries in the world, access to education for young girls is much more limited than young boys. Because of societal norms and financial restraints, it's typically the young girl that stays home and helps the family work and get money. Even when it comes to sex trafficking, many times young girls in these impoverished areas sell themselves, their bodies, their services in order to get an income for their family. In addition to that, because of lack of hygiene and feminine products, when a woman does begin her menstrual cycle, she has to miss 25% of school, because there's no way to have your menstrual cycle and go to school. Can you imagine for 25% of your life as a child, teenager, young adult, woman, to not be able to go to school or work or do things with your family or for yourself or get water or do anything because you don't have access to a feminine product like a tampon or a pad? There are so many more challenges against young women as well. For example, early marriages that provide financial value are extremely common. In young, early marriages, women tend to get pregnant much younger. They don't have access to any sort of prenatal education or healthcare. And most of the time, they don't have access to a doctor when they are giving birth. And we're not even talking about the basic line of malnutrition for a young mother and a newborn baby. So gather all of this along with just the social stigma for women of having to be at home and raising children and typically eating less, having less water, also being the ones that are fetching water, sometimes miles a day. These societal domestic roles for women, along with the stigma to keep women at home and not get access to education, keeps them in the cycle of poverty. There's a lot of work that needs to be done with education. Right now, we are working with the Kuponoa Foundation that specifically funds maternal wings in Tanzania. It's not just the medical supplies and the surgeries and the room and board. The Kuponoa Foundation helps transport women from rural villages so that they can get that support. Many times when a woman in Tanzania is experiencing prolonged labor, they get something called an obstetric fistula. This is essentially a hole in the birth canal, which leads to incontinence, which means you can't control or manage your pee. And in over 90 cases, women lose their baby, even if they've had it the full term. Now, this is 100% preventable. And that's what my nonprofit and the Kuponoa Foundation are working towards. It's not just the access to the healthcare and the surgery and the room and board and the transport, but it's the education of understanding this is what happens with continual lack of family planning, lack of contraception, lack of prenatal care, and lack of access of healthcare. In addition to all this, the Kuponoa Foundation also offers group classes for women to not only bond if they have lost their baby, but try to overcome these social stigmas, because if you lose a baby and you have this incontinence, you are isolated from society in Tanzania. You are looked down upon. Your family, your husband, your children will look the other way. Yes, this is cultural, but it stems from lack of education. Not just lack of education for the women in these developing countries, but also in countries all around the world. We don't understand the reason why this keeps happening, why this cycle of poverty continues, when in so many countries there's a surplus of money and technology. You're kind of like wondering to yourself, how is it possible that there's these two extremes existing on one planet? Well, it's a lack of education for everybody. Your support makes a difference, either just by learning, by commenting on the content we create, by giving even $5 a month. It's part of the solution, part of the long-term solution. That was a little heavy, but it's also empowering, because the more people that understand the core issues when it comes to lack of healthcare accessibility or funding or clean water or malnourishment, the more progress we can make as a collective.